Ontario is looking now at a worst-case scenario, more dire than it has seen at any point in the pandemic. Sources are telling CBC News that new modeling to be released today, set for 1 p.m. Eastern, for the province, shows staggering case numbers ahead. The province could announce its heaviest restrictions yet as early as today. The Premier is scheduled to make an announcement at 2:30 p.m. Eastern, and we will certainly have that live when it happens. Here is the potential daily case count that we're getting in advance of that new modeling's release. Up to 18,000 new infections per day by the end of May, if the current trends keep going and continue apace. Now, that is nearly 4 times higher than what we saw just yesterday, which was itself the record so far. The modeling shows new restrictions could bring the numbers down, but they'd still be far higher than what we've seen in the pandemic, about 10,000 cases per day if these mitigation strategies take hold and if the public health measures were considerably tougher than they are now and followed by Ontarians. It's a major story coming up today, and we have team coverage on it for you this morning. John Northcott is right there on the left of your screen, and we'll be talking specifically about the moves Ontario may be making as it attempts to get numbers under control. But we have Evan Dyer as well in terms of a federal response, and Evan is in Chelsea, Quebec. Ontario, Evan, asking its neighbors and Ottawa for desperately needed help, and there is an urgent national call this morning as well for a Canada-wide response to the pandemic crisis. Why don't we start there with that breaking news?
Right. So this is the Canadian Medical Association weighing in on Canada's strategy, which of course is based on provincial level jurisdiction over health. So because provinces are essentially the front line of any healthcare response in Canada, that's how this whole pandemic response has been coordinated. That's how the vaccination rollout has been coordinated. And to a pretty great extent, most provinces have been left on their own to handle this. They've received assistance from the federal government, but there hasn't been an awful lot of cross-border interprovincial cooperation since the early days of the pandemic, when we did see Alberta, for example, step up with ventilators for other provinces. But the CMA is saying it's time to leave that behind, that there's an urgent need now to forget about jurisdictional matters and prioritize saving lives with COVID. And the CMA has put out a statement specifically about that with regards to vaccination. It says the CMA is also calling on the federal government to consider a reprioritization of its vaccine distribution strategy to focus on areas of urgent need as opposed to per capita approach adopted to date. So right now, vaccines are distributed on the basis of population, not on the basis of COVID caseload. Some provinces, of course, are facing much more severe third waves than others. Others have really escaped the third wave. Ontario looking at close to 5,000 new cases a day compared to, say, 3 in Nova Scotia, 2 in Newfoundland, 2 in PEI. Obviously, those are much smaller populations, but that's still a dramatically lower per capita rate. Yesterday, John Tory, Mayor of Toronto, spoke with the Prime Minister, and he also talked about perhaps redistributing more vaccines his way. Let's listen to what he had to say this morning on Metro Morning.
I just talked about the acute nature of the situation in Toronto, which he was aware of course, and just said that, if we were going to decide to place a priority on hotspots and on places where the spread of these variants is most acute and use vaccines as one of the powerful tools we have to fight that we needed some help with that in terms of some extra supply. And I made clear to him that in Toronto, we have the capacity to do much more.
There's no response yet on that, Heather, from either the federal government or from provinces that might see their own vaccine deliveries cut in order to send more to provinces such as Ontario. It is obviously a very sensitive topic because provinces that have done better in the pandemic may very well object and say, we put more severe restrictions on our people earlier, and now we're being penalized by having our vaccine distribution cut. So this is a thorny area that the CMA is wading into.
So we're going to get some additional reaction to all of this coming up, Evan. I'm interested, though, Ontario, we're going to go to John in a second to talk about the kind of modeling which is propelling Ontario to be considering some very tough measures right now, in addition to asking for help from other provinces, federally. What kind of assistance is Ontario looking for at this critical point?
Ontario is looking in several different directions for help. First of all, going to the federal government. And this is not only about vaccines, of course, but also about people, the resources that the healthcare system needs to deal with the people who are already sick. And Ontario has made an urgent request to the federal government, to the Department of Emergency Preparedness Public Safety, asking for 600 critical care workers to be sent to Ontario hospitals. Last night, the Prime Minister had a conversation with 3 mayors in 3 of the most affected cities in Ontario, which are Toronto, Mississauga, and Brampton. And they laid out for him the kind of concerns they have about overcrowding in their hospitals and the resources they need to deal with that. Let's listen to one of those 3 mayors, Bonnie Crombie of Mississauga, talking about the situation in her district.
We know that patients are being transferred out because we can't handle the capacity. Both hospitals are over capacity, I think 104% capacity. So the situation is very bad.
Now, we have heard back from public safety that they've received a draft letter, but still no response, although they say they're in discussions with the province of Ontario to see what additional resources might be available. Ontario is also asking Alberta and Saskatchewan to help. Those are still informal requests, we're told at this point. And so far, no formal response, although Saskatchewan's Scott Moe's office did give CBC News a statement that was perhaps not all that encouraging, saying that Saskatchewan is focused on providing care and vaccines for its own people. Both of those provinces, of course, are also dealing with a fairly major caseload of COVID-19, but I think it's a sign of just how badly Ontario needs help. It's asking for help wherever it can get it.
Evan, thank you very much. In Chelsea, Quebec, that's Evan Dyer, beginning with breaking news from the Canadian Medical Association and the requests by Ontario for assistance from Alberta, Saskatchewan, and a response pending from the federal government. Let's look to Ontario, because even as it reaches out to other jurisdictions, John Northcott, it is also, as one would imagine, as we speak at the cabinet table, looking at finalizing details for restrictions to be announced, we expect later this afternoon. And based on what sources are telling CBC News, considering what would be some of the toughest measures we've seen yet in this pandemic.
Yeah, and just a reminder of the numbers that we're talking about here, Heather, in terms of that modeling. 18,000 daily cases hitting the province of Ontario potentially by the end of the month of May. That would be 1,800 people in ICUs. That would be 1,800 families hanging day by day, hour by hour, unable to talk to their relatives, certainly unable to see them, waiting for the call from the doctor or the social worker to try to update them on the latest health condition of the person that they love so much. That is the reality that the province is facing. The Assistant Deputy Medical Officer of Health, for the province, underlining that. Here's Dr. Barbara Yaffe.
Unfortunately, our situation is dire. These data are alarming and should be of tremendous concern for everyone. I have been providing updates to Ontarians for over a year now. And at some of the previous press conferences, I referred to the situation as worrisome and even scary. What is truly scary is that when I used those words before, our rates and our trends were nowhere near where we find ourselves today.
What you're seeing there is a healthcare professional who, as she says, over a year has been delivering a serious message, a message that you can tell she admits is now in a situation where she cannot really find the words to describe the escalation that has occurred, and not only the number of cases but in the concerns, and arguably in the inability of the system to come to grips with an influx of cases to that extent. We understand that the Ministry of Health has asked the province for another $350 million, this to provide another 1,000 beds, and also talking about deploying of personnel. And this is one of the key cruxes in all of this, in which we're seeing this with the request of the federal government as well. Even if they have the physical beds, these are very intensive team with often dozens of personnel involved in the care of each patient. And whether or not people are trained, whether they are able to deal with the procedures province by province, is a big question mark in all of this. So later this afternoon, around 2:30, we expect the Premier, the Solicitor General, the Health Minister, and others to come out and talk about some new measures to try to deal with this. Let's look at what we understand some of those new measures may be. We're talking about close non-essential retail, no curbside pickup or delivery, prohibit outdoor gatherings with non-household members. So even meeting somebody in the dog park 2 meters away wearing a mask, not recommending, in fact, arguing that should not be allowed at all. Tighten indoor capacity for places like worship, for example, and weddings. The other big issue on this is closing down warehouses and manufacturing for anything but all non-essential industries. So automotive, they might keep open. Food and medical, they might keep open. But so many other manufacturing facilities, construction sites as well, talking about closing those down and talking about enforcing them, going around and inspecting them as well. How do we get here? Let's listen to Dr. Isaac Bogosh.
After the second wave, or the second wave hadn't really come down all the way, we rapidly reopened, giving virus, variant or non-variant, irrelevant, we gave this virus an opportunity to transmit. It's definitely time to act in a more definitive manner to get cases down quickly.
Those are the calls from the medical professionals, and as we're seeing, Heather, as you started off the top with the CMA making a nationwide call out to do something about this and to do it in a coordinated national way.
John, thank you very much. 2:30, as you say, from the Premier, live coverage on CBC News Network. And John referencing the Canadian Medical Association and the statement they came out, the urgent call for extraordinary measures. Let's look to more on all of this. Fortunate to have with us this morning Andre Picard, who is a journalist and author, an award-winning health columnist for the Globe and Mail. He's in Vancouver this morning. And Andre, welcome back to the program.
Good morning.
You were listening to that coverage, I know, prior to you, and heard about the Canadian Medical Association, the statement that came out about an hour ago warning of where Canada is, a critical juncture, and calling for a truly national approach in the way that Canada responds to a flood, a fire, a hurricane, a natural disaster of that nature. Is that what is needed right now, Andre?
Absolutely. I think this is quite an unprecedented call from the CMA to saying to governments, you have to get your act together. We're really losing the plot here. We're really in danger of things getting out of hand. And hopefully this will finally get government's attention to stop, niggling along and start taking this seriously.
What would it even look like, though, a national approach in a country where provinces so jealously guard their healthcare territory?
Yeah, I think, we fall behind. We always look to the Constitution, but there's no impediment in the Constitution to cooperating. And that's what the doctors are saying. They're saying, listen, do stuff together, have a common message. There's all these confusing messages in Canada. One of the most important things in the CMA statement is saying where it's going well in Canada, lock down now. Don't wait for it to get out of hand like Ontario. Ontario's made the same mistake over and over again. Alberta, where they just reopen too quickly and things explode, and it's getting worse with each subsequent wave.
One of the things they call for, one of the specific measures that Evan was outlining, is to reprioritize the vaccination distribution strategy in the country and no longer distribute doses on a per capita basis, but send vaccines to areas of urgent need. Now, would that make a difference in your estimation?
Well, obviously, it would make a difference. The question is that politically doable or palatable? I think it's been difficult politically, but we're seeing a country like Germany has a similar system, and they've done that. The federal government has stepped in and taken away power from their states, and that's essentially what the CMA is saying to do here in Canada. I don't know if we have the backbone to do that, but obviously it would make a difference now to vaccinate in the areas where we see cases really exploding, and this is parts of Ontario, parts of BC, Alberta, Saskatchewan. This is not just an Ontario problem.
I wonder, though, not just politically, if even logistically it is possible to reorient things, because so far ahead in the planning, pausing, coming up with a new strategy, it would delay things even further potentially.
Well, you make a very good point. It's hard to reorient when it's not clear that we're oriented in any way. So the vaccine rollout has a number of difficulties, and to make it more focused is certainly necessary, but is it doable in the short term is a big question.
I'm glad you're here on the breaking news, and we've pivoted to vaccination, and that is really my original intent to talk to you about this, because one of the things that's generating quite a lot of discussion is your most recent column for the Globe and Mail about vaccination, specifically about the AstraZeneca vaccine and the concerns as very rare cases of blood clots that are linked to the AstraZeneca vaccine surface around the world. And Canada had its first case this week in a Quebec woman who has diagnosed and treated and is recovering at home. In your column, this is the line: we've reached the point where we seem to have totally lost our ability to judge risk rationally. What are you seeing that's causing concern?
Well, I think since day one in the pandemic, one of the single most important things has been communication. And the communication on vaccines has really been, it's all over the map. People don't know what to think anymore. There's, take the AstraZeneca vaccine, which we're talking about. It's safe. So the science tells us it's safe. There's a very small risk of blood clots, but it's much, much lesser than, say, blood clots with COVID or other products. So scientifically, it's safe, but politically, socially, the communication is people are scared, they're fearful because they have doubts. And once you have doubts, once you have fear, it's hard to get people on board. And this is undermining the entire vaccination effort. It's making people more hesitant. It's making them stay away at a time where we desperately need people to get vaccinated quickly.
What are the consequences of that? I'm just thinking not just in Canada, but the impact of this globally too.
Oh, yeah, this is not unique to Canada. Some countries like Denmark have stopped using this product altogether, and they've been very clear. They say it works, but it's just too much grief. Now, the difference between Canada and Denmark is they have a lot of vaccine. They don't have a lot of coronavirus. They can afford to wait. They can afford to say, we're going to wait for our Pfizer stock to come in 2 weeks. I don't think Canada can afford to wait at this point the way our cases are exploding. So everything is about trade-offs, and this is a really important trade-off that we have to get the public on board to make.
You made the point that other medications, and I think it's worth referencing what you note specifically in your column, that drugs we take every day, including Tylenol, birth control pills, heart medication, sleeping pills, all have potentially severe side effects. And again, just to quote you, Andre, we accept those risks generally or don't think of them. Why do we expect vaccines to be magically problem-free? It is a conundrum, isn't it?
It is a conundrum, and it's, a lot of it has to do with we're in a pandemic, we're hyper vigilant, we pay attention to every little small nuance without paying attention to the nuance. So we see these headlines about the vaccine. I think most of the media coverage is quite good. It talks about this balance of, it's not really a big risk to people, but people just sort of grasp onto the headline and say, oh no, the vaccine's no good. So there's really a PR problem here that I don't know how it can be resolved, to be honest.
Really? That was my last question to you, because you said the best we can do is forge ahead. I mean, you could walk in, if you're in the age category, walk in to a pharmacy and get a shot right now. There are doses of AstraZeneca because some people are deciding they don't want to get it. And so, as you say, to counteract exactly at a time when the need is there in the country to have vaccination, what does it look like to forge ahead? What do we do?
Well, I think practically at this point, you take the vaccine that's available to you. The shot in your arm is going to be really useful. There's going to be very little risk. If we're in a different circumstance, if we had unlimited amounts of every vaccine, we weren't in a hurry, we could have a different conversation where we pay attention to the image. But we don't have time to worry about a vaccine's image. We have to worry about protecting people against a rapidly exploding third wave.
Andre Picard, I thank you very much for your time and expertise joining us from Vancouver today.
Thank you.